Hi everyone, my name is Rebecca Grube and I'm one of the certified athletic trainers here at Cerner that runs our motion health program. Thank you for choosing to participate in this workshop where I'm going to walk you through a simple way to assess your mobility and provide you hopefully some greater clarity about the areas of your musculoskeletal system that need a little bit more attention and focus. Our goals throughout this series of mobility workshops are to make you more aware of the current state of your joints and tissues and provide you some simple solutions that with daily practice will make drastic improvements in how you feel and how well you move. This is not about exercise. This is really about the ability of your joints and tissues to be more resilient after a long day of yard work or playing with your kids, to feel better at the end of a work day as much as you did in the beginning, and yes, to recover well after a hard workout. Moving well and moving often are really crucial to your overall health. So let's get started. Okay, so we're going to walk through 4 different positions which will assess all the major joints of your body: the hips, the ankles, the shoulders, and then the spine. As we go through each position, I really want you to pay attention to these things. First, are you able to get into the position that I give you? And secondly, what do you feel in those positions? Are there areas that feel tight or congested? Are there areas that feel pretty good for you? Is there any uncomfortable pinching type of pain present? So keep those things in mind as we go through each of these. Once you've completed the whole workshop, it's really a great one to come back to after you've been working on your mobility exercises, which will be in the other workshops, for several weeks to see if you notice any improvements. So the first position that we're going to get into is called the hip 90-90, and it's the position that we use to really evaluate the mobility of your hips. What you'll want to do first is to get down onto the floor, and I want you to square yourself off with a wall right in front of you. That's typically how I think is easiest to do this. And I'm starting with my right leg in front, so my right thigh is going to be pointed perfectly straight towards the wall in front of me, and my left thigh is going to be perfectly straight towards the wall to my side. And then my knees, I want to have 90-degree angles at. So you'll see it's a pretty open position. I'm not sitting like this, I'm sitting more like this, okay? So the first question that I always ask people is, how does it feel to sit in this position? What areas of your body feel uncomfortable, and what are you noticing? Some of the expectations that I typically hear from people is that they'll feel either a lot of congestion in kind of this trailing hip, and sometimes they'll feel a lot of stretching kind of in the back of this leading hip. So the things I'm looking for are you able to sit up into this position in an upright position? Do you feel the need to lean over, or are you able to sit upright? The other thing is, are you able to maintain contact with this leading knee with the ground? People that have a lot of mobility restrictions in their hips will often have to bring this front knee off of the ground, and they'll also have to kind of shift this back hip up off of the floor. So again, we're trying to maintain decent contact with the ground at all of these points. This position is really looking at the tightness and the restrictive quality or the mobility quality of each of these, each of your hips. Now, one thing that you want to pay attention to is if you feel any pinching pain in the front of this leading leg. If you feel that pinching pain, it's something that you might need to get evaluated by a professional. So feel free to reach out to me or someone on my team to further talk through that. Now, if you're someone that's able to sit in this position comfortably, then you might be someone that has a decent amount of flexibility. That doesn't always mean that you have a good amount of mobility. Mobility, if you read the document that's attached to this workshop, is a combination of flexibility plus control. So again, if you're able to sit in this position comfortably, I want you to try a second move. So I'll turn here so that you can see what I'm doing. I'm actually going to try to lift my trailing foot up off of the ground. And I want you to try to hold it there for several seconds. Now, if you get a muscle cramp, that's okay, that's pretty common, but just see if you can hold it there for several seconds. If you're not able to, that can indicate a little bit of a lack of motor control or strength in the muscles that surround that hip. So, before we move on to the next position, I actually just want you to switch sides now and bring that left leg in front and the right leg behind. And I want you to compare how you felt in the first position to the second position. So not only are these positions good assessment tools, but they can also be leveraged as a first solution to really improve your mobility. Simply get into this position, find a stretch, so it can be here, it can even be here, and hold the position for upwards of 2 minutes. A really short blurb on stretching. I tend not to prescribe a whole lot of static stretches, and that's really because research is showing that stretches held anything underneath a minute long are really pretty ineffective. So in order for your cells to receive that communication of that stretch and for them to know how they're supposed to adapt, you really need to hold stretches upwards of 2 to 3 minutes. Okay? If you find that you're unable to sit into this position comfortably, so you're leaning over, one of your knees or hips is coming pretty far off of the floor, or that you're unable to lift that back foot up off of the floor, then I highly recommend that you check out a couple of our other workshops, the mobility cars, as well as the lower extremity mobility series. Okay, so this next position that we're going to get into is called the combat-based position, and it's going to assess the mobility of your ankle, a little bit of your knee as well. So you're going to start in a kneeling position, and you're going to bring one leg up, and you want to kneel your foot right next to your knee. Okay, your kneeling leg, you also want this back foot to be flat on the ground. And what I'm simply going to do is place my body weight over this target knee, and I'm going to lean forward as much as I can and try to keep my heel on the ground. If your heel starts to come off of the ground, then you want to kind of back up just a little bit until that heel comes back on the ground. So a few things that I'm really looking for in this position. The very first thing is A, keep the heel down. The second thing is you want to look to see what angle your lower leg is at. For me, I try to keep it about 45 degrees or I'm looking for it to be 45 degrees or greater. But an easier way to think of that is how far past your toes does your knee go? And you would really want it to be several inches past your toes. One of the mobility dysfunctions that I see is when people's lower legs are pretty vertical to the ground or perpendicular to the ground, or just even slightly past, or if you can actually see your toes past your knee, then that would be an indicator that you've got some mobility deficits here. So some things that I would expect you to feel in this position are possibly some congestion in the front part of this ankle. You may also feel kind of a stretching sensation in the back part of your lower leg and down into the Achilles tendon. Kind of a word of caution, if you've got some knee issues or mobility restrictions within your knees, this may be a little bit of an uncomfortable position for you to kneel into. So a good thing, modification to make would be to place a pad underneath this front knee or even underneath the back ankle. Now, if you're able to get into this position pretty easily, then you may have a good mobility if you're able to get this knee past your toes several inches. So kind of an advanced move that you can try to see if you've got some good motor control in the ankle is to simply try to lift that foot up off of the ground while I'm keeping the heel on the ground and see if you can hold it there for several seconds. That can indicate good amounts of motor control. The great thing about this position and this exercise of lifting the foot up is that not only is it a good assessment tool, but it can be used as a first step towards your treatment plan. So Again, just if you have trouble with this position, just get into the position and hold there for about 2 minutes or more. Or you can, again, if that's easy for you, lift the foot up off of the ground, hold for several seconds, and repeat that for several repetitions. If the ankle mobility is an issue for you, then I would highly recommend you take another one of our couple workshops, either the mobility cars or the lower extremity mobility workshop. Okay, so this next position is really a two-parter, and it's going to assess the mobility of your shoulders, your shoulder blades, as well as your spine. So the position I want you to get into is face down, and I want to make sure that your forehead stays on the ground throughout the entire movement. And as we go through the movements, you're also going to want to make sure that you contract your glutes. And that's really important so that you're not utilizing your lower back to compensate for a lack of control in your shoulders. So the first position that you're going to try to get into is to place your hands on the back of your head. Okay? And I want you to keep your hands on your head, but just lift your elbows up off the floor. Get into this position and see if you can simply do this. Okay? The second thing I want you to try is to put your hands on your lower back. And same thing here. Keep your hands on your lower back, but lift your elbows up. And are you able to get into this position? Okay? So if you are able to get into this position, then sort of the advanced movement is to go ahead and go back to placing your hands on the back of your head. And here, to test your motor control, is to lift your hands off of your head straight up towards the ceiling. Now, for a lot of people, they're able to lift their hands up, but they might have kind of a shift or a rotation in their hands. So you want to ensure that your hands go straight up towards the ceiling. Same thing with the lower back. Place your hands on the lower back again, and can you lift your hands straight up towards the ceiling? So the first one, just simply getting into the position, is testing your mobility. The second, lift and hover, is really testing your motor control. So a few things that I'm really looking for when I'm assessing patients in these positions is, one, are you able to get into the position? Two, are you able to lift your hands up out of the position? And some things that I would expect you to feel when you're in the position is a stretching sensation in the front of the chest as you lift your hands up. I would also expect you to feel sometimes some mild muscle cramping up here in the muscles of the upper back. That's completely normal. A third thing would be just the inability to get into position, especially if you have some mobility restrictions within the shoulder. Some of the dysfunctions that can be a limiting factor to this particular mobility assessment is restrictive tissues around the shoulder joints, a lack of motor control in the muscles that control the shoulders as well as the shoulder blades, some stiffness within the rib cage and even the middle and upper parts of the spine, and then too much reliance on the lower back to create movement in your upper extremity. Those are some really important things to keep in mind. So if you're not able to get into this position, one of the great things about this particular assessment tool is that you're not only using it to assess your mobility, but you can also use it as kind of a first step in your treatment process. So just getting into the position and holding it there if you're unable to in the first place, or to do a series of hovers out of the position. So in this particular position, he can go ahead and lift his hands up off of his back and hold there for a 3, 2, 1 count. Relax, and then he would repeat that for 3 to 5 repetitions. And he can do the same thing with his hands above, on top of his head. So if this is a struggle for you, or you notice some mobility issues within your upper back and shoulders, which, let's face it, most of us have some issues here, I would highly recommend that you check out a couple of our other mobility workshops, the CARS workshop, as well as the upper extremity mobility workshop. Okay, so that wraps up our Assess Your Mobility workshop. Hopefully you have learned a few things about where your joints and tissues are at in their current state, and you're now armed with a few solutions to move forward in improving your mobility. For more information on what mobility is and why mobility is important, I highly encourage you to read the attached document to this workshop. And also, if you've experienced any pain during any of these mobility assessment positions, please don't hesitate to reach out to us. Our contact information is also found in the attached document to the workshop. Again, thanks for participating in the workshop, and don't forget to repeat the assessment on a consistent basis to see if you've made any improvements. Have a great day.